Hello friends, I am Dr. Vikram Sharma, consultant arthroscopic surgeon and sports medicine specialist, Fortis Escorts Hospital, Jaipur. So friends, in this video we are going to talk about some interesting topics. Many times when patients come to our OPD and during the history taking, it is almost confirmed that there is an anterior cruciate ligament tear in their knee. So often this question is asked to us that what are the things in history that can confirm diagnosis of ACL tear? Purpose of this video is that you can self-diagnose and understand injuries of ACL. And I want to share these points with you with the same intent. So first thing, when we talked about the ACL injury in previous videos, we knew that the commonest mechanism for anterior cruciate ligament tear is twisting. Which means when your leg is straight and your body is moving like this, then this spring or elastic ligament in the knee breaks due to pulling more than its limit. Or sometimes hyperextension, which means this leg goes backwards. All these conditions can lead to ACL injury. So the first clue, always focus on the mechanism of injury. If you are a practicing doctor or physiotherapist, or if you are a sports coach or if you are an athlete, then you can understand that whenever similar mechanism of injury occurs, then the possibility of anterior cruciate ligament injury is quite high. It can happen during the game also. Or it can happen in a two-wheeler accident or during other daily activity, which can lead to ACL injury. So the first clue, always focus on the mechanism of injury. Second clue. Whenever there is a lot of swelling after 2 to 3 hours of twisting injury. As you can see, this condition is called haemoarthrosis. That means blood inside the joint. Whenever there is a twisting injury, there is bleeding in the joint. The joint is a closed structure, so there is no space for the blood to go out. So what will be the result? There can be huge swelling on the joint. So first clue, if it's twisting injury. Second clue, if there is a lot of swelling after 1 to 2 hours of injury. Then you can assume that in 50 to 60% of the cases, they have had an anterior cruciate ligament injury. I hope you have understood these two clues. Third and very important clue. In history, it is often heard that a person who has had an injury of ligament, typically during a two-wheeler accident, after falling, when he tries to stand up, then immediately he gets a re-injury. In common language, they say that when we tried to stand up, they could feel some snap or tearing sense inside the joint. So during their history, they often say that after the injury, when they fell and tried to stand up, they felt that their knee will come out. Or they are afraid of falling down, or they can fall down again. So friends, if you get a history like this immediately after the injury, then it is almost confirmative of anterior cruciate ligament injury. What is the reason for this? The main reason for the joint to be stable is anterior cruciate ligament. If there is a twisting injury, the anterior cruciate ligament is broken. And when a person tries to stand up again, till that time, their brain does not know that their knee ligament is broken. So they try to stand up in the same way as it is common. That is, they try to stand up in similar way as pre-injury. But because there is no ligament in the knee, then they feel an instability. They feel that they will fall down or the knee will come out. In common language, they say that they feel that the knee is not stable. So if this point has been told in history, along with twisting mechanism, presence of swelling after 2 to 3 hours, along with third clue as explained, then it is almost always confirmative of anterior cruciate ligament injury. What happens next is, initially you are afraid of falling down. But slowly you adopt your body. That is, you will put less weight on that leg. Or you will focus on the thigh muscle and the leg muscle. That is, you will keep your attention on this knee. So friends, keep in mind that this is not a recovery from ACL injury. This is a cautious walking. So the fourth thing that we try to know from our patients, we directly ask them that you have a normal knee and a sick knee. Do you feel any difference between the two? Mostly answer is yes. Second thing, have you modified your lifestyle? That is, when you walk on a bumpy surface. Do you have to walk very carefully? Or if you do this, do you feel the fear of re-injury? Have you fallen again due to instability? After your first injury? The answer is yes. So friends, in this way, if we follow all these clues, then without any investigation. Although investigation is definitely needed, and always needed before proceeding for surgery, or before confirming the diagnosis, MRI is required. But still, these are some clues. If we follow them, then we can confirm that that person has had an anterior cruciate ligament injury. In chronic cases, that means old cases, when years have passed post-injury, and the treatment of ACL is not done. So we see that the affected thigh has started to become thinner from the other thigh. What is the reason? Because the use of that leg is decreasing. So it slowly starts to go into disuse. Disuse means whenever we reduce the use of something, then it gradually weakens. So due to disuse, it can also become thinner. So friends, in this way, in this video, till now we have understood that first clue is mechanism of injury. Twisting, if it is confirmed. Second is swelling. After 2 hours, there is a lot of swelling in the knee, which is called haemoarthrosis. Third clue is re-injury, or feeling of instability. Again, they feel that they will fall again, and the knee will come out. Fourth clue. During continuous activity, they have to do cautious walking. They have to take care of the knee. If there is any instability feeling while walking or running on uneven surfaces. And the last clue. In chronic cases, the thinness of the thigh. And sometimes in chronic cases, we can get pain in it. So friends, in this way, we take care of these points. Even before MRI, we can confirm. We can do primary diagnosis. That in which person's knee anterior cruciate ligament tear has occurred. And that is why we should go for further treatment in these cases. So I hope that this video will prove useful for you. If you find such symptoms, anyone around you, or to a player or any active person, you must think of ACL injury. And even before MRI. On the basis of these symptoms, you can diagnose that person's anterior cruciate ligament. Only on the basis of history. In the future, when you go to the doctor, they can do some clinical examinations and confirm it. And it can be almost proved by MRI. So friends, thank you for watching this video. In this regard, if you have any queries, you can post in the comments. Or you can contact us on our WhatsApp helpline and share your MRI to us on 95870774444. Thank you for watching video.